Hi all. I see folks are still joining, so I will just wait 30 seconds or so before beginning. But I do want to say that I think this format is different to the others so far in the IHCC Summit, in that your audio is enabled, and this is intended to be a roundtable discussion. So please feel free to interject, raise your hand, and otherwise interact with me. I won't be able to see the chat questions while I'm on screen share, but again, just please feel free to interrupt me at any point. Okay, so I am just going to roll on. My name is John Connolly. I'm a researcher at the Children's Hospital of Philadelphia, but I also coordinate the IHCC Scientific Strategy and Cohort Enhancement Work Group. So I prepared some slides to kind of foment discussion here based around the IHCC cohort survey. So I'll quickly kind of go through the slides, beginning with just an overview of what the IHCC cohort survey was and is and will hopefully become. And then we'll look quickly into kind of the survey data, which will hopefully, again, foster some discussion around kind of future directions and how best to leverage our collective resources interests. So the purpose of the IHCC cohort survey was really just to give us a kind of snapshot overview of our membership, first of all, in terms of our capacity and our collective resources, and also in the types of support that we can provide membership from the IHCC leadership and secretariat. We have some broader questions in there for all of you in terms of obstacles and challenges that kind of get in the way of collaboration and research in general. And obviously the lower middle income country agenda is very high on the IHCC priority list. So we had some specific questions there relating to challenges that folks that self-identify as LMICs face kind of in participating as a member of IHCC. I want to stress that this survey does have many limitations. We're very conscious, obviously, that you guys, your time is valuable, so we wanted to make it short and easy to complete. So the trade-off with that is it really, it's really just a rough overview of our capacities and our interests, and there's not a lot of granularity available to us. So it's just a very much a big picture thing. So that's the caveat there, that is not a competitive resource, comprehensive resource for understanding our cohorts or our priorities. Really, it's just kind of a big picture of ourselves as a collective. I'm going to go through the data that we collected in the past 12 months, which again, hopefully will kind of foster additional discussion. So the survey, the cohort survey was disseminated this time last year at the 2021 annual summit. It kicked off, I think, November, and then the following 3 months, November through early March, many of you will have gotten reminders from the Secretariat, and kind of a heroic effort, I would say, to kind of complete the survey and to contribute your data. I think at the time there was 102 IHCC members. I know membership has grown since then. So that's a response rate of just over 41%, which is pretty good for this kind of self-report questionnaire. And the survey itself, there were 3 kind of broad categories of information where we collected. We collected background demographic information on our cohorts. The bulk of the study was really focused on cohort members' collective research priorities and the data that they have available. And then the third part was collecting information on our kind of collective experience and needs and interest in terms of sharing, collaboration, and training that we can provide. So I'm going to now jump right into the actual data and just kind of give you kind of a quick overview of what we found today. And again, please feel free jump in, ask a question at any point. This is very much intended to be discussion based. So these are the sites. So we, like I said, we had 42 completers. We had other sites complete after the deadline, but we had to draw a line at somewhere in the ground to kind of in the sand to proceed with analyses. So first of all, a huge thank you to all of you sites here that have that completed the survey, and it's immensely valuable to us in terms of learning about future directions and funding priorities and other things, which I'll speak about subsequently. So let's just kind of look at what we are. And again, the data I'm about to show is just based on those 42 responders, not on the entirety of the membership, which is over 100 cohort members. So collectively, we comprise, and these numbers are, I would say, very conservative estimates of our membership and of our resources. So basically, people responded in kind of bands of what they, what was available, and there were quartile bands of what was available on their specific cohort in terms of demographics and makeup and specific data. And we chose the responses down the narrow end of that band. So if it was 10 to 25%, we're assuming you only have 10% for any any individual component. So just based on that conservative estimate, we have over 21 million unique research participants across those 42 cohorts. Unsurprisingly, the majority of those individuals are comprised of people of European ancestry, but we do have ample numbers of individuals of Asian, Middle Eastern, Black, and Hispanic or Latino ancestry as well. So for each of those sub-cohorts, well over a million individuals available for collective analyses pending, future collaboration. So that's obviously a hugely powerful resource. In terms of where those individuals come from, we just broke it apart by continent. So about half the survey responders were from North America and Europe, but also again we had representation from Australia, South America, Asia, and Africa. So again, quite a diverse cohort of responders as well. So again, that kind of reflects the diversity of the IATC as a research enterprise. In terms of who was responding from the business model, the majority of responders were either entirely or primarily not-for-profit cohort members, but we did have 4 for-profit members as well, or primarily for-profit members as well. So again, that's another kind of element of diversity that it was important to capture, and obviously important to bear in mind as we kind of think about future research endeavors. So let's look at what we have available on those 21 odd million people across those 42 surveys, 42 cohorts, I should say. So this, I struggle a little bit to kind of figure out how to present this slide, but hopefully it somewhat makes sense. So the y-axis here is the proportion of the cohort with sample type available. So so just over half the cohort, there is a plasma sample available on all or nearly all of cohort participants. So what that translates to is about across the network over 7 million individuals with a plasma sample that has been collected. Smaller numbers of individual with blood samples available, and smaller again in terms of saliva samples available. But again, that's a hugely powerful resource that's available. That is, available across the IATC, and really we need to think about ways, and in discussion with the leadership, ways to kind of leverage that massive amount of data there. So what I did at this point was I went in and kind of broke out what was available to members that were self-identifying as LMIC versus not. And what you'll see is that the folks that self-identify as LMIC, they actually have more data available in terms of plasma and blood samples. So there's not necessarily a gap if you're thinking about collaborating with one of IATC's many LMIC sites, that there is a lot of data there already available in these sites that is kind of good to go and off the shelf. So again, for kind of thinking about fostering collaboration between non-LMICs and LMICs, there's a huge amount there available in our LMIC cohorts that are kind of like essentially surpasses what's available in our non-LMIC cohort. So that's a very, very positive finding, I find. In terms of the data types available, again, globally across these 42 cohorts, unsurprisingly, the most common data type available is demographic data, which is available on pretty much everyone. These kind of small bands up top here between 90 and 100%. That's accounted for by the industry members that do not necessarily have demographic data available on their representation. But again, there's a huge amount of data available right across the collaborative. So in terms of permission to share data, over 80%, that translates to over, I think, 16 or 17 million individuals where data can be shared. We have geocode, or we have at least addresses for over, I think, 10 million individuals, which can be geocoded and overlaid with, public repositories to again, can do all sorts of environmental analyses. Huge proportion of participants can be recontacted. Again, thinking forward to kind of funding and supporting prospective studies. There's, for a lot of the cohorts, there is that ability to recontact their underlying cohort. So again, a huge capacity there. And then probably some kind of smaller numbers, but again, in the several millions in terms of the types of data available for lab measures, genomic data, less so EHR, and unsurprisingly, kind of the least kind of accessible data there is imaging data, which is hard to get hold of. But again, in the several millions. So again, I broke this apart into what's available at our LMIC versus our non-LMIC cohorts. Again, we can see that the folks identifying as LMIC kind of surpass in terms of surpass the non-LMICs in terms of what's available in their cohorts for data types. So right across the board, the LMICs are essentially outperforming in terms of the data available and their readiness for kind of collaboration in the immediate term. So again, that's very encouraging, I think. Folks were asked about their research priorities. So I've organized this slide here from left to right in terms of data available. So the kind of these two kind of bars here on the left-hand side, GWAS and PRS. Most cohorts have GWAS and PRS data available and good to go. So in terms of kind of what we can do in the immediate term, that's the lowest hanging fruit. That there's a lot of GWAS data, ready to go off the top. And again, you can see that kind of all the way over to the right-hand side where there's less data in terms of availability for rare and orphan diseases. Again, I'm going to break this apart into LMICs and non-LMICs. And again, relatively similar patterns across both kind of subsets of responders. Again, we see a lot of genomic data available to sites identifying as LMIC. So again, that's again very positive and encouraging and something that we can really look to build on. In terms of kind of resource gaps, so this kind of orange band, these orange bands here, those kind of reflect research interests, and kind of the biggest kind of bands where there's an interest but not necessarily data available is in epigenetics and PGX, and that's true for both LMICs and non-LMICs. So again, in terms of, in the future, thinking of where we could kind of dedicate kind of enhancing our collective resources, those are the kind of two areas that showed up as kind of of primary interest, but not necessarily data available. So again, just something kind of for all of us and for leadership to think about kind of where we might want to look at kind of addressing gaps if we can. We did ask a bunch of questions just for folks that self-identified as LMICs in terms of funding, in terms of challenges that they face. And unsurprisingly, I'm sure this is true for the non-LMICs as well, funding is always the biggest issue in terms of trying to get projects off the ground and getting collaborations together. And, I think that's something we're just all accustomed to dealing with at this point. But there are other issues as well that are maybe a little more LMIC specific in terms of lack of infrastructure and training. Lack of access to EHRs came up, human resources and government support. So again, that's it's just something to think about. But also an interesting finding when 4 of the 19 responders to this emphasized that access to cohort population can be difficult for a variety of reasons, just in terms of physical access to underrepresented communities, to access to their actual residents, to the ability to recontact. Similarly, there's some issues in terms of just being able to foster that collaboration in terms of getting collaborations off the ground. And this is something the ICC obviously is intending to support, and our role there is to try to facilitate that. So again, obviously for some cohorts, that's certainly necessary. And one responder had issues around privacy, which again, I think we would probably all share across the network. The third part of the survey was what folks were kind of interested in terms of the type of education and training that the ITC can provide for our members. And I think this was reflected in the presentations this morning, that the ITC webinars are certainly extremely well attended and are kind of primary interest to our membership. So I think it was 83% of individuals there are either interested or very interested in the webinars. And I think we had heard that in the previous education presentation, we had over 100 attendees. So again, that's a huge kind of interest in webinars. But there's certainly interest in other types of education opportunities that the ITC can provide. In terms of cohort curriculum, a cross-cohort exchange program has been mooted. Summer school program has been mooted as well. So again, these are initiatives that in collaboration with the educational work group, we can think about supporting as well. And certainly the majority of responders were interested or very interested in each of those potential initiatives. The final kind of few slides I had prepared is around environmental data and what is available and of interest to our cohort members. 50% of folks do collect environmental exposure data. 36%, an additional 36% are interested but have limited data. I just wanted to point out that just to kind of transpose that with the earlier questions we'd asked around address of contact information for individuals. So over 70% of sites do have contact or have an address for their underlying participants. So that those addresses can potentially be geocoded, and like I said previously, can be used to overlay and with public available data on various air pollutant exposures, for example, access to highway or proximity to highways, access to food banks. There's a whole bunch of environmental data that is in the public domain that again is extremely low hanging fruit, especially if you do have a participant's address and length of stay at that address, that we could, I think, tap very, very easily. And there's a whole other glut of environmental data there as well that are of interest and are available, which I'll show on the next slide. So again, in terms of relevance to the cohorts, obviously lifestyle is a major environmental variable that is relevant pretty much to everybody. Obviously, diet and medication and social determinants of health as well. So I'm just going to move on to the next. I think this might be my final slide, at least, in terms of supplementing exposure data with cohort-specific questionnaires. Again, there's a huge amount of data available. And again, this translates to collectively, I think, over 18 million individuals. We have some level of additional exposure data through questionnaire available in terms of underlying participants' education, diet, lifestyle, a little bit less so in terms of medication. So again, that's all there, and it's a resource that is, potentially untapped. So again, I just present that as to foster discussion around how best to leverage this data and to move forward in terms of building and fostering further collaborations. I'll just conclude my proportion here of the overview of the survey with the next steps and what we're going to do with this data. So first of all, the survey data has been used to inform the cohort data atlas, and I know Thomas spoke about this already this morning, that it's really, really important if our cohort members, if you can, I put in the chat window already, if you can complete the cohort survey, they're a huge benefit to us in terms of first of all, understanding what the IHCC is and what we can provide, but also in terms of thinking about future directions and plotting where we want to go in terms of with our resources and our research priorities. I think it's really, really, really important for us to get as many responses as we can. So again, the 2022 version is live, and please click on it and click through. So that data has been used to populate the cohort data atlas in those level 1 and level 2 bands that Thomas spoke about, and ultimately will hopefully be used to support additional expansion through the atlas onto level 3. And like I said, it's hugely important to informing strategic planning going forward. I think that's all I had prepared in terms of slides. So I think what I'll do at this point is I'll stop screen sharing, and I see there's a couple of chat questions which I'll jump into now. So what are the range of cohort sizes between non-LMICs and LMICs? So the LMICs, I don't have the specific data on hand. Certainly the larger cohorts that are in the several millions were primarily LMICs. But collectively, the non-LMIC cohorts, I think it was about between 3 and 4 million. I don't have exact numbers. So again, they tend to be on the smaller side, but still certainly very ample. Okay, and then we have the survey link there as well. So again, if you can copy that out and put that in your browser, that would be super, super useful. So at this point, I certainly welcome any comments in terms of how best to leverage this data. So again, please feel free to ask a question or jump in at this point.
Hi, John. This is Ronglin. Very good presentation and the excellent work. It's very informative. And have you also included the survey asked about people about to what extent their data can be shared internally among the cohort consortium and externally for outside the scientific community?
Right, that's a brilliant question. Thanks, Rongling. So we did in the previous iteration of the survey, we did ask questions about that, but we really didn't get into too much granularity other than can you or can you not. But the version that's now in your chat box does include an enhanced set of questions about specific, offering more granularity in terms of what folks can and cannot share, whether they can share, within their local institute, within their country, or internationally. And I think it's very, very important to capture that. It's pretty much, it is a requisite for being an ITC member to be able to share on some level, but with the current version of the survey, we'll have much more detail in terms of what folks can share. Can they share just summary data, or can they share individual type data, and what steps need to be gone through to get access that data. And again, this is something we spoke about this morning and Michelle spoke about in terms of some folks have a local committee where you need to go through, other folks it's just out there in the public domain. So again, we will have data hopefully from this current version on all of that, and again that will be ported across to the folks working in the ICC Data Atlas, which again that information will be available to everybody to see.
Great, thank you.
John, this is Michelle Ramsey. Maybe just a comment. I think these data that you have presented are going to be really useful when we think of our first use cases across the consortium. Like, you know, where are most of the data? How can we think about collaborating and working together? And, you know, you've had more time to think about it. Have you seen any opportunities?
Yeah, well, there's lots of opportunities. All right. So I think kind of one of the slides I presented was really just kind of in terms of, you know, data available versus research interest, and the kind of the two kind of areas where there was that kind of a gap between what was available and where folks want to go were in the fields of epigenomics, epigenetics, and PGX. So those, I think, and certainly PGX is a kind of a very low-hanging fruit, right? It's I don't have it off the top of my head now, but I think it was 70% of folks do have medication data available on their respective research participants. So that data is already available. If we can direct our efforts to kind of either from a funding perspective to kind of capturing genomic data that could lead a whole PGX effort, I think that is something that's kind of addressable through funding. The other kind of side of that is what can we do without any funding? And in terms of what's available currently, GWAS data is available. I can't remember how many million I said, 15 or 16 million individuals just across those 42 cohorts, right? So again, there's probably double that available across all 100 and something cohorts. That data is available, good to go, and just kind of needs kind of like a jump start from the research community, from the funding community to kind of really kind of build upon it and grow it going forward. I think we're just about at time now, so unless there's any more questions, I might just shut up. Okay, so I think we're at time. Thank you all very much for joining. Hopefully this was interesting. I'm happy to share slides with anyone that needs it. And again, final reminder, if you can, please complete the new IHCC cohort survey. There's a lot of skip logic in there. So if you answered it last year, you can skip through a lot of the questions that you answered previously. So it should take you maybe, I think previously it took less than 9 minutes to complete. The current version, probably less again. So if you can do that, that would be a huge benefit to all of us in the IHCC.